And indeed, and we were able to go ahead and start vaccination clinics for healthcare workers of the community that have not already been vaccinated, but also to open it up to citizens of the county that are here that are. We started with those that are over 75. They're 75 and older here, and we were branched out over to the KCAC Center.
Yeah, so that is where these are being administered right now. But there are guidelines in place, and there are ways for people to get on a waiting list. This is the first time actually a waiting list has been available, isn't it?
That's right. We have a website form that is out there for availability for people to sign up. It's at irmc.org/vaccine form, and it's available on the website as well. We encourage everybody to go ahead and sign up in all categories, both in those that are 75 and older, healthcare employees, and also those who are 65 and older, and those that are with medical conditions, and those that are younger as well.
There's also guidance that will direct you to the CDC or the Pennsylvania Department of Health website, actually, to help you determine what classification you're in, right?
Correct, exactly. It's there on the website.
All right, so all of that is available. Now, some questions about getting in line, getting contacted, and when you fill out the form, that's the first step in a process that will get you actually to the point where someone's poking you in the arm.
Correct. Once we have availability of vaccination slots, we will contact you back by email to be able to invite you to go ahead and sign up for a vaccination slot. If you don't happen to have an email, we ask that people help their elderly adults and parents to go ahead and help them to get signed up, and put your own contact information in the comments form to be able to help the community to be able to get vaccinated.
Now, for folks who have absolutely no access to email, to the internet at all, they can call, but really strongly encouraging people not to tie up those phone lines by making the calls.
Exactly. And we're asking the primary care practices in the community to go ahead and think of those people who are most isolated and most at risk, and with the fewest resources, to be able to have them reach out to them and assist them in both the filling out of the form and also in using community resources to get people to the appointments.
So take me inside this process. People fill out the form. IRMC then takes over from there. How do you determine, is it a daily, let's sift through what has come in and put them in the proper slot? Is that how it works?
We do this on a week-by-week basis based on what we have as far as vaccine availability. Cull through the list, make a schedule for the appointments, and then start contacting people, inviting them to go ahead and sign up. We try to make sure that we get every dose used and have no extra dose that's wasted.
How is it that you settled on 75 plus as the first benchmark in the current round?
In the current round, with the limitation of the vaccine that we have and the number of people in the community that are 75 and older, plus the reality is that the people who are 75 and older are at most risk for hospitalization and death. And that's what we're trying to help with, to reduce those risks for that population. And we will absolutely expand beyond that group once we have additional vaccine.
That's the thing about this, is the availability of vaccine really is far beyond your control. It's what comes in, and that is under the control of the state, which is, of course, guided by the federal government and their shipments.
Correct. And the Department of Health, they have new leadership just recently, and they're reevaluating their processes, and I have strong faith in their ability to be able to help try and manage this, but they themselves are only getting knowledge of what vaccine they're getting on a week-by-week basis.
People, of course, are, they're always concerned about what the decision-making process is. I think one of the important things for people to understand is yes, we do what we can when we have a decision to make, but really a lot of these decisions are being made at another level, at the state or federal level, and we're really in the position of just reacting to those decisions.
Correct.
Yeah.
Yes.
We're talking with Dr. Richard Neff. He is the Chief Medical Officer at the Indiana Regional Medical Center. So what are some of the other things that people need to know about this particular announcement that vaccines are now available, or about the vaccine in general?
Well, I think some of the things that people need to remember is that After the vaccination, we're still needing to social distance, wash our hands, and wear masks when we're in community availability. It's still not entirely known whether or not you can catch the virus and pass it on to others, even though you've been immunized. At this point, we only have about 1% of the county that is either immunized or have recently had COVID and thus are protected. So we need those numbers to be much higher in order to be able to go ahead and really squash this virus.
People wonder as well about the second shot because we know that as you invite people in now to get their first shot, in a few weeks they'll be invited back to get a second shot. And people are wondering, well, does that mean that you're holding back enough to get that second shot or just relying upon the fact that you do expect more to come?
That's a really good question. What we're doing is scheduling the appointment at the time that you get your vaccine. We're scheduling that next appointment for the second shot. And the Department of Health has been very clear that they will prioritize those second shots and to make sure, and they've made that promise to go ahead and say that they will make sure we have vaccine supplied for those second shots.
People wonder about the Johnson & Johnson vaccine because it's going to be a one-shot deal, whereas the Moderna and the Pfizer vaccine are two-shot deals. You have no control over which vaccine you're getting, and as these things improve, this is just, this is the very beginning of this. As much as we want it to be near the end, it's the very beginning of this. And,
yes.
And so people say to themselves, well, does this mean that when the new shots come in, they'll be stronger, they'll be better, I should wait? We don't want anybody waiting.
I don't think anyone should wait. The Johnson & Johnson vaccine has some increased ability to be used in areas that are farther away from the hospital than the current vaccines that we have available. So there's some advantages to that for some of our more remote regions, but there's no reason to go ahead and wait. If you're on the priority lists and you're getting contacted, it's still recommended to go ahead and get the vaccine that's available.
Something else I was reading this morning, actually from Fox, was, wow, that's a loud truck, was that some people are reticent to go to a vaccination clinic because they're afraid nobody else has had their shot that they're there. They're all waiting in line, and so they're at risk by standing in line around people. So distancing is very, very important at the vaccination clinics themselves.
That is true, and that's one of the reasons why we're using the appointments. The KCAC staff and IUP have been very helpful in supporting this process. Our staff thoroughly evaluated the room and the space and the walkthrough, and I was just over there. People are socially distancing in line, and we're getting people in and out in a very timely fast fashion here. So doing whatever we can with the huge space that is down there, it's a very good space for being able to vaccinate.
Two more questions I have for you this morning. The first of those has to do with a new term that has come up, unfortunately, vaccine chasers. Those are people who just show up unannounced at vaccination clinics and say to the people there, hoping you have an extra one, you can just jab me in the arm right now. Don't do that.
Right, exactly. We're having to do these by appointments because we want to be able to continue our record of not wasting any vaccine. Through the last 2 months, we have only wasted one vaccine, and so we look at that, and the appointments are incredibly important to go ahead and help maintain that. It maintains the social distancing that we need, and it maintains the ability for us to be able to administer vaccine to everyone who's there.
And also, as we consider down the road in a week, 2 weeks, a month, 2 months, whenever that time frame may be, we hope it's as short as possible. When more vaccines become available, IRMC is asking for some help from qualified people who can help them at vaccination clinics, which might not just be at KCAC, but might be at other locations in Indiana County. Who are you looking for? How do people volunteer?
Thank you for that question. So we're looking for people who are qualified to be able to vaccinate. So LPNs, registered nurses, paramedics, EMTs, those that have qualifications, pharmacists who have the qualifications to be able to vaccinate, and physicians who have the time to be able to vaccinate and the background and skill to be able to do that as well. Mm-hmm. We're also looking for a limited number of people who can serve as greeters, and then some people who are able to do the really technical side of things of the data entry that is required by the Department of Health that takes a focus and a amount of time.
All right. And to do that, to volunteer, there's a special email.
There's an email, info@irmc.org,
Very
and
good.
that will get answered as we are able. And we thank all of those who have thus far have been able to volunteer.
Info@irmc.org. I would guess that there are some retired nurses and doctors around Indiana County that would be more than willing to step up.
We certainly hope so, and we've had some that have stepped up already.
That's terrific. That's terrific news. Okay. Anything else that we want people to know about this?
I would just say that I have, in my 3 months here, have been incredibly impressed by the people of Indiana County and the region here. And I would just say that if we can remember the kindness of the fictional character George Bailey, the kindness and thoughtfulness for our neighbors and our friends, that will go a long way to helping us all get through this.
Oh, good one. George Bailey. We've heard of him around these parts. Dr. Richard Neff, thank you so much for coming in to visit with us. We appreciate the information.
Thank you, Mr. Marino. Have a fantastic day.
You too. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.